Thank you, Rob, and thanks everyone for having me. So I'm going to talk a little bit about some work that I've been doing on analysing depression and trajectories of school performance using linked health and education data. So this has formed the basis of my PhD work. And to look at this, we've been using a novel and large-scale data linkage hosted at the Maudsley Biomedical Research Centre. So this is a data linkage between the Clinical Record Interactive Search, or CRIS, and the National Pupil Database, or NPD. So CRIS was mentioned in an earlier talk, but just very briefly, it's the system by which we can access anonymised electronic health records for service users of South London and Maudsley NHS Trust. And the NPD contains data for pupils in England's state schools. As a result of this data linkage, we have access to educational records for about 276,000 children and adolescents. So this consists of children who were referred to child and adolescent mental health services between 2007 and 2013. And then also children who were resident in the SLAM catchment area in that same period. So about 30,000 of this number here were linked successfully to CAMHS records, indicating that they were referred to CAMHS at some point in that period. So we have essentially education records for a cohort of linked clinical cases and unlinked controls, so to speak. So my work in particular has been making use of depression and school performance data. So perhaps stating the obvious, the depression data comes from CRIS, it's recorded in diagnosis fields, and school performance data comes from the NPD. It's recorded for assessments which are sat in school years 2, 6 and 11. I think probably many of you will know these more informally as primary school SATs in year 2 and year 6 and GCSEs in year 11. So we designed a study to describe school performance trajectories of children who received a diagnosis of depression and investigate whether these trajectories varied according to their socio-demographic characteristics. We identified a sample of new referrals to SLAM between 2007 and 2013, who had received a first depression diagnosis sometime before their 18th birthday. They had a local address registered, and by virtue of their linkage to the National Pupil Database, they had school performance data for at least one of those 3 assessments, which I mentioned. So this resulted in a cohort of about 1,500 children with depression. And we analysed their school performance trajectories using linear mixed models for repeated measures. So for those that aren't particularly familiar with this, this is linear mixed models. They're a generalization of linear regression where you can model repeated measures data without violating assumptions of independence. I've put a citation down here that goes through it in quite a palatable way if you want a brief explainer article on that. But the outcome variable then was school performance, and the predictors were assessment year, gender, ethnicity, free school meal eligibility, which we used as a proxy for deprivation, age at diagnosis, and interaction terms. So what do we see when we model this? We standardized assessment scores relative to a local group. So if you can imagine the sort of average pupil in the local area, what you would expect to see typically is a trajectory centered on 0 at all 3 time points. That would represent the average performance level. What we see when we model this among children with depression, we see that in primary school, they seem to perform slightly above average. And then in secondary school, when they come to year 11, you see this quite drastic decline in their school performance. You can see here that I've plotted males and females separately. So males typically perform lower than females at all 3 time points, and that's reflective of what we see in the general population as well. But nonetheless, for both genders, it's the same pattern of stable, reasonably high performance in primary school, and then a drop off at GCSE. We've modeled this for the other characteristics as well. So on the left here, you can see it's broken down by free school meal eligibility. Those who are more deprived on the red line, again, performing lower than less deprived groups at all 3 time points, but nonetheless, this same pattern of stability in primary school and a drop off at GCSE. And on the right, mapped out by ethnicity, you can see some little variations here, like this purple line here representing an other ethnic group, showing a slightly different trajectory of change in primary school, for example. But again, even so, it's this similar pattern again of average or high performance in primary school and then a drop off at GCSE. So overall, this seems to show that those who receive a depression diagnosis from CAMHS before age 18 show a pattern of stability in their school performance between year 2 and year 6, followed by a drop in year 11. And this pattern seems to be pretty persistent across many socio-demographic groups. So what we're seeing is quite a pervasive loss of potential, essentially, in this clinical group. Interestingly, the drop in school performance seems to coincide with the median age of depression diagnosis. So the average age of diagnosis in this group was age 15, which also happens to be the age at which most adolescents embark on their GCSE year. Hopefully as well, this shows the interesting sorts of analyses you can do using these large scale and quite versatile data linkages. So it's really great to be able to harness these linkages between health and education records. I think I'm going to leave it there. We recently had this work published in the British Journal of Psychiatry, so if you want to read about the study in more detail, then that's where you can go to find out more. But I think that's all I'm going to say.
Thanks very much, Alice. So there's some questions emerging. Can you look at when depression was diagnosed with GCSE at age 16, but CAMHS data up to 18? Some people may have had their diagnosis before or after GCSEs.
Yeah, so we've actually done a follow-up study along those lines, which I didn't have time to talk about here. But we have taken a group of adolescents who received a diagnosis before they sat their GCSEs. So we can see that depression diagnosis is associated with subsequent school performance, rather than it just being the sort of mash of, as you've probably noticed, different diagnosis ages and exam years as well.
Another question about how representative is the sample, do you think?
Well, it's representative of those who presented to CAMHS with depression in the South London and Maudsley boroughs. So maybe not widely representative. I think, you know, one really critical thing about this is that, again, we're only observing those who have presented and to secondary mental health services. So those with depression in the general population who aren't presenting are inevitably missed by this kind of work.